been 1 week since legendary singer Jimmy Buffett died. The cause of his death, a rare and very aggressive skin cancer called Merkel cell carcinoma. Here to talk more about it is Dr. Andrew Salner, the director of Hartford Healthcare's Helen and Harry Gray Cancer Center at Hartford Hospital. Dr. Salner, always great to have you here on the program. Welcome back.
Thank you.
So first off, for people who are not familiar with this type of skin cancer, what is Merkel cell carcinoma?
Merkel cell carcinoma is a skin cancer that arises in the epidermis, the outer layer of the skin, from Merkel cells, which are cells that provide hormonal and neurologic function in the skin layer. And it's a rare cancer. There are only 3,000 cases in the United States a year, compared to 3 million of the common basal cell and squamous cell cancers and 100,000 melanomas.
And why is this form of skin cancer so much more aggressive?
We don't really know for sure, except to say that it seems to access the lymph channels in the skin much more quickly than the basal or squamous cell cancers do, which tend to remain localized, and therefore can spread more rapidly, and that's why it's important to make an early diagnosis.
A lot of people are talking about this type of skin cancer because of Jimmy Buffett. He meant so much to so many people, and a lot of that is because of his lifestyle.
Yes.
And he lived his life on the water, in the sun, and that's really who might be most at risk here.
It's pretty clear that this cancer, similar to other skin cancers, does have sun exposure as the main risk factor. It tends to occur mainly in the face, neck, and shoulder area, areas that are exposed most frequently. It tends to be more common in men than women. We don't know why. It tends to occur more in people over the age of 50, probably related to cumulative sun exposure. It can also occur in people who have a weakened immune system because they're on immunosuppressive therapy for transplant, or they have HIV infection or other reasons for being immunocompromised.
And what do we do to prevent it? I mean, obviously, we hear all the time sunblock, cover up.
Sunblock, decrease sun exposure, wear sun protective clothing, stay out of the sun, don't go to tanning booths. It relates probably to the number of sunburns you get, so you have to start these good behaviors as we have to start them for our kids.
Right. Is there a certain skin tone that might be more at risk?
It's more common in people with light-colored skin, Caucasian people. It's because it's so rare, we don't know as much about it as we do the more common skin cancers. But we do know that it frequently shows up as a lump in the skin, and sometimes that lump is not pigmented. It's the same color as the normal skin. And therefore, one of the things that people should look for is not only color changes in their skin, which we advise for looking for melanoma, but lumps that don't go away in the skin. And you know,
because it does not present with a discoloration, it's really important to have yourself checked.
Correct.
Regularly with your dermatologist, right?
Correct. I recommend, certainly as people get older, they should have an annual skin exam by their dermatologist. And I also recommend a once a month take a look at yourself and have your partner take a look at your back, the places that you can't see.
Everything.
And if there's something that persists and it shouldn't be there, please get it checked out.
All right, Dr. Salner, thanks. Really important information.
My pleasure.
We all need to keep that in mind.
Thank you.
All right, thanks.